Chapter 24, The Childbearing Family with Special Needs. Almost 80% of all teen pregnancies are unintended. Many do not believe pregnancy can happen to them. Adolescents who give birth are more likely to have low income and may not finish their education, which can hinder them from getting a good job. There are 3 options a teen can consider when becoming pregnant. She can terminate the pregnancy, continue with it and give the baby up for adoption, or continue with it and keep the infant. The socioeconomic implications can mean sometimes the pregnancy expenses is not covered by the family's insurance. It's added expense to public cost if temporary assistance, WIC, food supplemental programs are needed. The children are born in the adolescent home is at higher risk for abuse. For some teens, pregnancy and a child to care for can motivate them to provide a better life for them. They are at risk for certain problems during pregnancy, including anemia, labor dystocia, preeclampsia, and preterm labor. We're not sure exactly why these are high risk for some of those issues, but seems to be inconsistent prenatal care can play a part in it. Prematurity and low birth weight, which is less than 2,500 grams, are more likely to occur in the adolescent pregnancies. They have a higher mortality rate as well. If born premature, they have a higher risk of organs not being mature. Low birth weight can be caused from IUGR, which is that intrauterine growth restriction, which basically means baby is not growing inside anymore. The placenta cannot function how it needs to and is unable to provide nutrients to the infant. Preeclampsia is more common in teens and can be a factor in the IUGR. Smoking can also cause low birth weight. Some teen fathers remain involved in the infant's life after birth, but others become phantom fathers, which means they're rarely involved or altogether absent in the child-rearing aspect. Most indicate they are not ready for fatherhood. Many teen fathers are from a lower socioeconomic group as well. Many teens have a hard time focusing on the care of an infant when they are so involved with thinking about only themselves, and this can make it hard to establish a loving relationship with the child. They are surprised at how difficult parenting truly can be. Nursing care for a teen pregnant woman can be challenging. Physically, you have to assess her health. Any underlying medical conditions? Any STIs? Drug or alcohol abuse? Is she anemic? As pregnancy progresses, having to watch for preeclampsia. How is her nutrition level? You also have to assess her knowledge level and be able to care for can she be able to care for the infant? Does she have support? Will she have family to assist her? Can she absorb the teaching that is being provided for herself and the infant after birth? Risk for ineffective health maintenance is a problem that can occur with this population. Deficient knowledge is also a common problem. Of course, your outcomes and interventions need to be directed towards a specific issue. Remember to assess the knowledge level and any cognitive delays before attempting to educate. Having a support person to be present during the teaching sessions can also be beneficial. On the other end of the spectrum is a woman who delays pregnancy, typically past 35 years of age. There are also risks involved with this as well. One of the risks include a higher incidence of trisomy 21, which is Down syndrome. Also, the risk of having pre-existing conditions such as diabetes, hypertension are also things to consider. The risk for postpartum hemorrhage is greater as well. She's also at risk for having a small for gestational infant. A few advantages include the women being more mature, more confident, and may have better problem-solving skills. They are more apt to be more financially secure as well, and many times can handle stress better. Disadvantages include, since she is higher risk for complications, she could miss more days of work, she may tire more easily, and she may have less peer support. Family support also may be less, since family members could be older. Nursing considerations include having them go for preconception visits to detect any underlying problems. Since she's higher risk for anomalies, being sure she understands the testing being provided and providing emotional support for her. Sometimes the older mom has a hard time adjusting to parenthood the first few weeks after delivery. They've had more time to have an independent lifestyle, and now they have to change, and that isn't always easy. They may not have friends their age for support with little ones. When a pregnant woman uses drug or alcohol, the fetus experiences the same effects. How the drug affects mom will affect the fetus in that same way. The infant cannot metabolize the substance, so the effects last longer. Table 24.1 outlines major drugs. Tobacco affects the fetus by increasing the risk for both low birth weight, prematurity, increased risk for sudden death syndrome after birth. It affects the mother by having decreased placental perfusion. So what does that do to the fetus? It can also cause abrupto placentae and premature labor. Alcohol affects the fetus and can cause a neonate fetal demise. IUGR, fetal alcohol spectrum disorder, and affects mom by increasing the risk for spontaneous abortion or abruptio placentae. Marijuana effects need to be studied more regarding the fetus or neonate and maternal. It's often used with other drugs. Cocaine can affect the fetus or neonate by causing tachycardia, stillbirth, prematurity, irritability, sleep followed by agitation, poor response to comforting. It affects the mother, causing generalized vasoconstriction, hypertension, abruptio placentae, precipitous, which is a quick labor. Opioids affect the fetus or neonate by causing IUGR, low birth weight, meconium aspiration, fetal or neonatal death, SIDS. It can affect mom by causing malnutrition, anemia, increased risk of STIs, and preterm labor. Toxicology screening can detect the use of drugs or alcohol, also monitoring the infant by non-stress test or a biophysical profile as well. Some behaviors associated with substance abuse include seeking prenatal care late in pregnancy, failure to keep their appointments, inconsistent follow-up care, poor grooming, inadequate weight gain, needle punctures are a few. Therapeutic management depends on the substance taken. If it was opioids, and having her stop taking it while pregnant can cause her to go through withdrawal, which can be stressful on the fetus and can cause fetal death. Methadone can be prescribed for a woman who's been using heroin. It's considered to be a synthetic opioid and keeps the drug levels even in the woman's body and causes less problems for the infant. Nursing care begins with assessment. Many times it's not just one drug that is being used, so getting an accurate list can help decrease the poor outcomes for mom and infant. You need to evaluate for the side effects of the drugs she's using. Knowing most will cause premature labor, knowing to educate regarding this and monitoring. Watching blood pressure carefully for the start of preeclampsia. Ineffective health maintenance is a good nursing diagnosis. Remember, the process for a woman to stop using drugs is slow, so you would not want your goal to be that she would stop using it in 2 days. That is not very realistic. A goal would be directed more at her understanding and stating the effects it can cause. She will be more motivated to stop. Interventions have to include providing appropriate care for trying to stop the medication. Being referred to a drug clinic can be beneficial. Assessing for her support level also will be important. There are many factors that will influence how families deal with a child with a congenital anomaly. Timing of manner of being told is a big part. If a family found out at 20 weeks their child has Down syndrome, then they have time to prepare and help be proactive in getting appropriate care for the child. Sometimes ultrasound or other prenatal testing does not catch things, so they find out right at birth and that their child has a heart defect or a cleft lip or palate. This does not allow the parents time to prepare, and they may have a harder time dealing with the news. Also, what type of defect can make a difference as well? A child with a cleft lip typically will not have issues once the surgeries are complete. You take a child who has Down syndrome, and that's a lifetime of caring for that child, and many complications can occur. Grieving and mourning for your perfect child is not an uncommon thing for parents to experience when their child has an anomaly. They may feel guilt and blame themselves. Offering support and using therapeutic communication can help. Nursing considerations include assisting with that grieving process, allowing them to express their feelings, and provide support will help. Parents can grieve differently, and allowing them adequate time to grieve is needed. We want to promote bonding and attachment. Find things about the infant that they can find positive. Look at her beautiful eyes. They look just like yours, Dad. Provide accurate information and don't provide false hope. Be sure to have open lines of communication, encourage them to express their feelings, and ask questions. Have them participate in the infant care. Planning for discharge includes any special equipment or teaching they may need. Start the education early so they have time to ask questions. Providing referrals to support groups and community resources may help as well. Perinatal loss can happen at any time during pregnancy, and it's never an easy thing. People deal with loss in a variety of ways, so we need to support and not judge. An early loss can be the result of a miscarriage, and some may not have told anyone else that they were pregnant, or they've told people, and now it'll be hard to tell them that they are no longer pregnant. Don't give false hope and tell them they can get pregnant again. Sometimes in multifetal pregnancies, a loss of one fetus can occur, and the other fetus survives. The parents can have overwhelming feelings of grief, but also guilt because of one fetus is okay. If they've had a previous pregnancy loss, they'll want to start prenatal care early. Many times they will be over anxious and need to know things are okay with this baby. Once again, providing the support and use effective communication techniques. Some women choose to put their infant up for adoption. This can be decided ahead of time, and the birth mother has chosen by the adoptive parent. I'm going to try that again. This can be decided ahead of time, and the birth mother has chosen the adoptive parents, or it can involve no planning at all. The relationship between birth mom and adoptive parents can vary greatly. The nurse needs to establish a trusting relationship with both the birth mother and the adoptive parents. During labor, the nurse needs to ask the birth mom if she wants to see or hold the infant at birth. Will the adoptive parents be in the room for delivery? What are the expectations from the birth mom? Typically after delivery, the infant is moved to a patient room with the adoptive parents so they can begin their bonding process. Education needs to be given to the adoptive parents and it should be for the birth mother. Intimate partner violence includes physical, sexual, emotional, social, and economic abuse. Factors that are associated with abuse include abuse of alcohol or other substances, depression, unwanted pregnancy, and frequent need for treatment for various complaints. Abuse during pregnancy is associated with health problems for the mother and the infant. They may start prenatal care late and have health problems like STIs. Infants are likely to have low birth weight and may be born prematurely. Sometimes men who batter their wives will batter the children as well. Children who witness the abuse may have emotional, behavior, or developmental problems. Factors that can influence include relationships where the man holds power and the woman has little value. The woman typically makes less than the male and still has to provide all care for the home and family. Alcohol or drug abuse can be a factor as well. Characteristics of the abuser: one that will keep the woman isolated from the family and friends. He attempts to control all aspects of her life. He controls the money and transportation. He often has poor control of mood and poor impulse control. He doesn't feel his behavior is a problem. The nurse's role is to assess all women for abuse. If we have a patient who is a victim, we want to empower her to make the decision to leave. She will only leave when she has a plan and wants to leave. Even though we may not understand why she stays, we cannot force her to leave. Provide her with the resources or referrals so she has it if she wants to leave. Many women won't tell you directly about the abuse, so watching for signs for abuse, which can include verbal and nonverbal. Having injuries that don't match the story is a clue, or she has injuries in various stages of healing. Provide support to her and let her know you are willing to help if she wants the help.